Because trust me, once you sign that, heaven forbid something doesn't go the way you expect, they're going to go back, but you signed it. And you're going to be like, well, I didn't. Well, why didn't you ask?
Right.
So you better believe they're going to rely on that. So you get to advocate for yourself and have the same expectation that what I'm signing reflects my understanding.
Yes, and we have a right to fully understand.
That's what that document that you're signing is saying.
That's what it's
that
saying.
You fully understand and that you've had the opportunity to ask questions.
Yes.
And if you don't take advantage of that, they're going to be like, well, you signed this. You get to do that.
You get to do that.
And my thing is any physician or healthcare provider that feels offended or gets angry because you are advocating for yourself or asking questions, that is a red flag.
Welcome to Get Real with Alexis Jones. On this podcast, we'll dive into real relationships with real people guided by the wisdom and perspective of some of the most seasoned voices in our community, our beloved seniors. Each week, we'll unpack the joys, challenges, and lessons learned about love, family, friendship, and everything in between. This is a space for heartfelt conversations, eye-opening truths, and powerful stories that will inspire and challenge the way you think about relationships. We're keeping it honest, unfiltered, and deeply meaningful. So settle in and let's get ready to get real. Let's jump in.
Hello and welcome again to Get Real with Alexis. I am your host, Alexis, and I have the pleasure of having with me again my special guest host and friend, Dr. Kim Redding. We've got somebody here that can really help us. Kim is not only a medical doctor, but she's a really good friend, and she spent years teaching at a renowned university, caring for other people, guiding students, and she has navigated this complex medical system. But life shifted for Kim when she herself became a patient facing several serious health challenges along the way. What happens when a doctor is suddenly on the other side of the exam table? What does she want us to know, especially those of us who are feeling overwhelmed or let down or dismissed by the medical profession? So this is not a conversation about fear. It's about wisdom, advocacy, faith, resilience, and learning how to navigate the medical community with confidence and with courage. If you've ever left a doctor's office feeling confused or unheard or let down or unsure, this conversation is for you. Please welcome back my dear friend and my guest co-host, Dr. Kimberly Redding. Hi, Kim.
Hey, Alexis. Thank you.
Kimberly is not just a physician and a college professor, but she's the mother of a daughter who is also a doctor. And so, hey, Erica, she's a woman with a powerful, I'm just going to ask the questions if I need to, but get some coffee, get some tea, settle in because you're getting ready to hear some good information. We have ours and we're ready. Here we go. Cheers. Kim, you shared some of your personal health journey with me, and I was really surprised. I'm reminded of what you often hear in the Black church. You don't look like what you've been through. So isn't it crazy how we think that medical doctors never have health problems? You're a doctor. You couldn't possibly know anything about health problems. No, of course you haven't had surgery because medical doctors don't get sick. It's crazy. But would you share whatever you want about your own health journey and what it was like when you realized you weren't just the doctor anymore, but now the patient?
Yeah, so I'm happy to share. I don't think about it often, but when I do, I am reminded that it's been a lot. And in fact, when I think about my journey, and these are parts of it that we haven't even gotten around to my sharing with you yet, but I'd say that my journey started when I was in college, and that was really one of the things that motivated me to want to be a physician. And when I was in college, I developed ovarian cysts, these what they call dermoid cyst or teratomas. I had never had surgery or anything before. Had the surgery, developed one, and then I was probably about a sophomore in college. And then about a year later, developed a second one. So the first one, they just removed an ovary. My mom, we didn't know any better. That probably should not have happened. But the second time I developed one, they didn't want to remove the ovary because then that meant I wouldn't be able to have children. So they just we went to a different doctor. He removed the tumor or this large cyst, and we thought that was the end of it. And then it turned out some months later, they were reviewing the pathology from the cyst, and there was malignancy in there. So it's tumor in there, like malignant tumor. And so then that was like, what do we do? What do we do? So that was, I think, my first real challenge was, at probably, I guess maybe I was 19 or 20, being faced with this cancer scare. And my mom faced it with me, my mom and dad. And I had an amazing doctor who helped us walk through that journey. So through a series of consultations, because there were to specialists. I was at Howard in college, to DC. And so we went to one specialist, and his solution was to remove everything, ovary, uterus, everything, chemotherapy, and that was that. And my mom at the time was like, no, that's crazy. She's 19 years old. And my dad had been in the military, so we were referred to Walter Reed Medical Center and faced the most compassionate physicians that said, no, we're not going to do that to this young girl. And so they came up with options. We'll do surgery. We'll follow her for years and test her and stuff like that. And I think it was that experience, kind of extremes of the healthcare system, that one really made me want to be a doctor, and two, helped me realize early how physicians and the recommendations and the advice and the compassion, the difference it can make. Because it was everything from this one doctor that just kind of his solution was, oh, take the ovary, to another doctor who was like, no, we want to preserve your fertility. To one oncologist was just take it all out, chemotherapy. To others who were like, had provided much more compassionate, thoughtful care.
And that's one of the challenges that we have. I know you know this, Kim, because we don't often have the support that says, no, let's get another.
Yeah,
So we are very trusting of the doctors. We think
exactly.
that they're going to recommend what is best for us.
And that's not
So,
always the case.
yeah.
And I really credit my mom, who had no experience with the healthcare system, but I think it was a mother's intuition that no, this doesn't feel right. It doesn't sound right. This can't be the answer. And my mother was really insistent that we get another opinion. So I had surgery there. They preserved the ovary. And then I was watched by their cancer patient. I didn't have to have chemotherapy or anything because they really felt like they had gotten everything in the tumor, but they wanted to monitor me closely. So I was monitored by them probably for about 7 or 8 years. And then I did fine. But it was also the doctor that I initially went to that preserved the ovary and all that I just absolutely loved. He was a gynecologist. And so I decided then I don't want to go to medical school. I want to be just like him. I want to provide that care to patients. And I actually wanted to be an OBGYN until I went to medical school and realized, ooh, that's hard. I don't want to be up all night, delivering babies and all that. So that changed. But my desire, but I think just my interest in cancer care, tumor biology, all of that is what really led me to be a pathologist. So that was kind of the first thing, and that was just my introduction to what it's like to be a patient And then I went to medical school, made a decision about the specialty that I wanted. And then in medical school, actually, I was in residency. So I did fine in medical school. I was in residency and just got sick. Started fever, joint pain, just really bizarre symptoms that we couldn't figure out what it was. And I ended up being diagnosed with an autoimmune disease in the middle of residency. And so they didn't know if it was lupus or dermatomyositis, which is another one. I was hospitalized. I was put on very high dose steroids. And it was just I developed this autoimmune disease.
What is that?
So it's an autoimmune disease is where your body, your own immune system starts reacting against itself. So your immune system normally fights against like bugs and organisms and foreign things that come into the body. It's how we keep ourselves healthy.
Yeah.
But in an autoimmune disease, and there are many different types for whatever reason, we don't know why, but your immune system begins to attack itself. There are different types. So I developed an autoimmune disease. Lupus is one of them, and multiple sclerosis. There are just a whole host of autoimmune diseases. There's so many sarcoidosis. I mean, there's so many, the list goes on that we're understanding now are autoimmune diseases. So I developed that. I was in my residency, so I was in my 20s at the time. And I had to take some time off. I was hospitalized. I was on high dose steroids, but we managed to control it. So that was kind of another introduction to the healthcare system was this autoimmune disease, and that's a chronic condition. So to this day, I still take medication to manage that. But I did fine with that, so that was kind of my residency.
Were you also still dealing with the first issue?
I wasn't still monitored for that. So I had already gone like maybe it was 7 or 8 years. But the one thing I didn't know is if I would ever be able to have children.
Yeah.
So that was kind of the concern. And my obstetrician gynecologist at the time said that because I had had one ovary removed and then the other, they removed part of it to remove the tumor. And then he was like, your ovary will it'll grow back, but it may not function the same. I may have a lot of scar tissue because I had a total of like 3 different surgeries. One to remove the first ovary that they took out. The second was the second tumor. And then Walter Reed, we did a third surgery to go in and just to take biopsies from all over my abdomen to see if there was any sign of tumor or cancer remaining. So I'd had 3 surgeries. And so they were like, my doctor was like, realistically, that may be something that you face. You may have difficulty conceiving. You may not be able to, but you may at least be preserved some of your ovaries. So my thing was more focused on wondering if I would ever be able to have children. But from the perspective of being healed from that, I was okay. And then developed this autoimmune disease. I was married at the time. I didn't have any children, but I did have to take time out of my residency because I was hospitalized on high dose IV steroids and all to try and get that controlled. And we did. And then, I was on treatment and medication for that. And then, kind of went along and finished my residency. And then I had flare. And then the autoimmune disease, I was sick with that for probably about a year. And then we got that under control. And I had been doing fine. And then suddenly I had a flare, which was like, oh my gosh, this is bad. So had the flare, went on some additional steroids. And then
What does that mean?
so when I had a flare up means the symptoms came back.
Okay.
So I had been controlled and doing well. And then suddenly the symptoms came back. And my symptoms were fever, skin rash, joint pain. Like I could barely walk because I had such severe joint pain and all. And so I started developing symptoms again. And I was just like, oh my gosh, this has come back. And then it turns out it came back because I was pregnant. And so my pregnancy triggered this flare up, because like an autoimmune disease, again, that your body recognizes itself as foreign. And when I got pregnant, you have like your husband's DNA in you, and my body perceived that as like something different. And I had this flare. So that's how I found out I was pregnant.
Oh my God.
Was because I had this flare, and it was like, it was so weird because I didn't believe I could get pregnant. So I wasn't even processing that. And I was just like, oh my gosh, I've had this flare up of this autoimmune thing. I went to, because I was managed by a rheumatologist. They're the specialty that takes care of you with that. And I went to my rheumatologist. They put me on steroids. We were just trying to manage the disease. And then I just noticed that I wasn't having a period. And I just felt sick. And I just thought it was, this autoimmune thing. And they put me on this new medication for the autoimmune disease. And I thought, that's making me feel sick. And then it was just like, I just felt so unusual till I thought, I was like, I wonder if I could be pregnant. And so I literally, yes, I literally told my husband at the time to go to the store and get a pregnancy test. And he just kind of looked at me and he's like, okay. So he went, got a pregnancy test. I took it. The thing lit up.
Pregnant.
Yes, I'm not kidding. And I was like, I was probably, okay, so it lit up. And I was like, I didn't believe it. I was like, okay, maybe some medicine. Now, I'm a doctor, mind you. And I'm like, not believing the pregnancy test. So then I made an appointment with my gynecologist right away. Got the appointment. They did a blood pregnancy test. And she said, you're very pregnant. And they actually did an in-office ultrasound. And there was a fetal sac there. I mean, I was like not a little pregnant. I was very pregnant. I probably was like into my first trimester because I had just been attributing all these symptoms to the autoimmune stuff. And all along I was pregnant. It was the craziest thing. So talk about a doctor not even processing that.
Well, you must have had. Were you elated about the pregnancy?
I was so elated, but then I was worried because I was like, oh my gosh, I've been on steroids. I've been on all these medications. Haven't gotten prenatal care or anything. And so I was really concerned about, the pregnancy at that point. And so at that point, my obstetrician, I was a high risk pregnancy because of everything that, I was, had been through. So they referred me to high risk care. And so they managed the pregnancy. And so I actually, did well with the pregnancy. So 9 months later, I had my very large child, Erica.
Really?
She weighed 9 pounds.
No.
1 ounce.
Are you kidding?
She was huge. So yes, I gave birth to a very big child.
You were very pregnant.
Yes, I was very pregnant, So I, had a relatively uncomplicated pregnancy. She had some problems when she was born because she had the cord wrapped around her neck. And it was so, we laugh about it now, but I had a vaginal delivery as big as she was. I don't know how that happened, but, But anyway.
Brandon was 10 pounds.
Oh, did you have vaginal?
Yes. And it felt like a watermelon coming.
Oh my gosh.
In the middle of it, I said, I don't want to do a vaginal.
It's a little too late for that. Yes. It was when those I was just like, oh my God. So she, because she had the cord wrapped around her, didn't, her breathing was a little impaired and stuff. And so they put her in the neonatal ICU like for a day or two. And I remember I was so panicked because I was like, oh, I hope she's okay. And we laugh now because we went into the neonatal ICU to see her. And there were all of these like little bitty premature babies. And then there's Erica. And here's this almost 10-pound child in the NICU. And there was comfort in that though, because I was like, she gonna make it. She got a lot to fall back on. So did fine. And then it was interesting, and I'm still, fitting residency in. So at this point, I had finished my residency. I was doing a fellowship in gynecologic pathology. So that's additional training after you finish your residency. And that's when I had Erica. And then it just so happened that she was probably not quite 2. And I started having pain when I was walking up and down stairs, just like this hip pain. And I was like, gosh, this severe hip pain. And I didn't really think a lot of it, but the pain got progressively worse. It was like I couldn't, like I would walk or, just going up the stairs was really painful. So I went to my rheumatologist and I said, I don't know why I'm having this pain. And I guess he suspected something. He did an x-ray and then he said, let's get an MRI. So I was like, okay. So he did an MRI and they diagnosed me with what's called avascular necrosis of the hips. So both hips. And so that means that you lose the blood supply to your hips, to the bones of your hips. And if there's no blood supply, that bone dies. And so the bone in your hips literally will die and your hip joints can collapse. So I had bilateral avascular necrosis and they believed that because it can be, and some people it just happens. It can be complication of different illnesses, and it can be a complication of steroid use. And so they felt that probably the steroids I was placed on when I found out before I knew I was pregnant, just because of the timing of it, because it was almost 2 years, they felt that I developed it as a complication of, the treatment then. And so that was like Erica was 2 years old and we had to figure out what are we going to do about this. And at the time, the treatment, what they were recommending was hip replacement to do both hips. Yeah, like bilateral hip. And I was symptomatic on the right. And that's the one that was hurting. The left, the MRI showed I had it, but I wasn't symptomatic. And so they were like, well, let's focus on the hip that's bothering you. But I was really young. I was like early 30s at the time. And they didn't really want to have to do a hip replacement because it's like if we do it now, they last for maybe 20 years. Then you'd be 50 and you'd have to have a revision. And then you could be literally 65 or 70 and we'd be out of options with your hip. And so they really didn't want to do it. So long story short, they were able to do another surgery. Emory is one of the few facilities where they had a surgeon that could do something that was not a hip replacement. It was called a graft, where they actually took bone from your leg, grafted it into your hip, and then took blood vessels from your leg and grafted it into your hip to try and save that bone.
Yeah.
And it was not done many places. I just so happened I was, I worked at Emory. I was doing my fellowship. There were doctors there that could do it. Wonderful doctors. Again, my experience with them was really good. The surgery was grueling. It was a 12-hour surgery.
Really?
Because it's a very delicate surgery. And then I had to be hospitalized for 10 days. And the room had to be warm because they don't want the blood vessels to constrict, because you're trying to get them to resupply that hip. So I had to spend 10 days in this hot hospital room. It was horrible. And then I couldn't put any weight on that joint for 5 months. So for 5 months, I started off in a wheelchair and then I had to be on crutches for 5 months. And mind you, my child is 2 months old. 2 years old.
Active too.
So my parents, my mom, dad, my sister took turns coming a month at a time to stay with me so they could help out. So got through that, and then almost a year to the date, once we got through that one, I started having symptoms on the left. So we had to do the same thing all over again on the left side. So I went through that surgery twice.
Goodness.
Yeah. So, got through that. That was difficult and challenging, but I managed to get through that.
How did you? That's a lot.
It's a
just
lot.
almost, it just doesn't seem real. As I listen to it.
One person.
One person, your young child, it happened before you even became pregnant. How do you maintain your positivity? Was that difficult? Where did your resolve come from?
That's an interesting question. And I don't know that I actually know. I think that initially I would say I've never been a why me person. It was just always like, Well, why not? People go through worse, And I always felt, I think one thing is I was blessed with a family that supported me. I mean, like my initial, when I had the cancer diagnosis when I was young, my mom, was there with me the whole time. Um,
Advocating.
I mean, advocating for me with the autoimmune disease. I was married, my husband was there. I had, my family was also there. And then with this, my family just immediately was like, okay, let's get our schedule. A month at a time, we're going to go there. And so I just felt so supported in it. And I think I just always genuinely believed I was going to be okay. I just believed it. It was just like, okay, this is just something that I got to get through, and then I'm going to be okay. I'm going to get to the other side of this. And I
And
just
was it the
believe that.
support, or do you think that had a lot to do with that belief? I'm going to be okay.
I think so, because I can only imagine how challenging it would be if I didn't have the support. So they were very supportive of that, and that made all the difference in the world. And so I can absolutely understand people who don't have that kind of support, what it would mean. And then I think because I am a physician, understanding of like really understanding what was happening to me and knowing, like, somebody really being able to explain to me and it making sense to me allowed me to navigate it. I know that's important, so I can certainly understand and empathize when you don't know. I don't know what it feels like to face health challenges and not know what's going on, not understand, or not know what questions to ask. Because I can only imagine that that's difficult. So I know the first hip surgery was in 1996 because it was the Olympics here in Atlanta. And then a year later was 1997. That was kind of, that major thing. And I really thought, okay, I've had my share of whatever, so I went with all my life, working, raising my child, doing fine. And then in 2016, I think the most major thing happened to me because in 2016, I was at work, um, on faculty teaching, and it was the Monday we had returned from winter break, 2 o'clock to head home. And a student emailed me and said they wanted to come by and talk to me about their grade or something like that. So I said, okay. They said they'd come to my office around 2 or so. So I was like, oh, I got to wait here till 2. So I told my daughter I'm going to be a little later because the student's coming by. And so the student came by, and I was sitting at my desk and I was talking to the student, and suddenly it was like everything just went black. And that's the last thing I remember. It was just like this feeling of this kind of almost like this curtain coming down, and it was just going black. And the next thing I remember is I woke up, I came to, and I was across my desk. I had just like fallen like down across my desk. And I remember I had like a cup of coffee or something because I was laying in this puddle of coffee, and the student was standing over me, and they were like, Dr. Redding, Dr. Redding. And when I came to, it was like I had the most excruciating headache. It was like I literally could not move my head, but I was conscious. And the student was like, are you okay? And I told them to go get the department chair because her office was just down a few doors down. I said, go get, Dr. So-and-so. So they ran and got her. And so she came. And so she said, are you okay? And I said, I can't move my head. And it was just the most excruciating pain. So they called an ambulance for me. And the ambulance came, rushed me to Emory Midtown, actually, and they took me to the CT scan right away, and I had a ruptured aneurysm. So I had a brain bleed. And so I had an aneurysm that had ruptured. And so,
My goodness.
and at that point, I don't remember I was in the ambulance. I don't remember a lot of it clearly, but I remember getting to the emergency room. I remember them taking me back to the CT scan. And then after that, I just remember being incredibly ill. I remember people rushing around saying, I've had this ruptured aneurysm. I had blood, like around in my brain and all. And they were transferring me to the neuro ICU at Emory's main campus. And so I remember they were getting me ready to go there. And then they must have, I remember being really sick, like nauseated. I started feeling really sick. And they must have given me something because then the next thing I remember being in the ICU at Emory. I do remember that. And so they ended up being able to go in like through the groin and they put coils in the aneurysm to stop it from bleeding and to repair it. They didn't have to like cut into my skull or anything. They were able to go through the artery in my groin and do it. But I was in the ICU at Emory for 12 days. So I was in the
My
ICU for
goodness.
12 days.
Do you know what brought that on?
Aneurysms, a lot of times you're born with them. And some people, you never know sometimes you have them and they never rupture. They don't, it's not like something happened to cause it. It's just a weak point in a blood vessel that causes it to bulge. And then sometimes people, if they have like high blood pressure or other things, atherosclerosis can cause them to rupture or can cause strokes and things like because it's a type of stroke essentially, but mine was because of this abnormal blood vessel that ruptured.
Why wouldn't they be able to see that before it ruptured?
Because the only way you'd see it is if you did a brain scan and did injections into arteries, and they don't normally do that. Most
They'd
people
have to have a reason.
they'd have to have a reason to do that. And so like now I get them like every 2 years because they monitor that one to make sure it's okay or whatever. But normally that's just not something people normally get unless you were symptomatic for some reason or, something else was going on and they wanted to do that to rule something in or out. So there was no reason for them to have ever done that. I never knew I had an aneurysm until it ruptured. And so that was
Please
that.
tell me that's it.
That's not it. And when people, I have to tell you this story my sister
Because
told.
it's just how does the human body withstand so much?
It's amazing what the human body can withstand.